Hello, I'm Emilia Dauway. I'm a surgical oncologist that specializes in breast and oncoplastic surgery. I'm American trained in practice for 15 years in the US and I'm currently practicing at Hervey Bay Hospital in Queensland, Australia for the past 6 years. I'm the clinical director of surgery and the author of the book, Live Fearlessly, Liberating Your Life After Breast Cancer. I've been practicing yoga personally off and on for years, and I started to learn more about the philosophy and the active practice of self-awareness, which is mindfulness. And I noticed within myself that I became more calm, more responsive instead of reactive. And so I really felt a lot of mental as well as physical benefits from yoga, and I wanted to share those benefits with others, but particularly my patients. So we know that mindset has a significant impact on mental and physical well-being. And in my practice of breast cancer treating patients, I realized that many patients live silently with fear of recurrence and death long after they've successfully completed treatment and survived breast cancer. And that's really not any way for any one of us to live. And so although all of us are going to experience in our lifetime significant struggles and challenges, we can't change the fact that we're going to experience stress, but we can change how we respond or allow stress to affect us. So there's many practices within yoga, not just the physical practice of yoga, but there's many limbs to yoga. And mindfulness and the philosophy of yoga, of self-awareness, is a very powerful practice. One of the things that's important is that patients practice acceptance as one of the pillars of mindfulness and acknowledge the fear that they do feel. And a lot of times they lack awareness of how their mind and their body is feeling when they're fearful or when they're under stress. So starting to create body awareness, which is just something as simple as a body scan, understanding what that stress feels like in their body. It could feel like holding the breath. It could be breathlessness. It could be muscle tension. Whatever it is, acknowledging it as it's arising within. So we practice those techniques actually in the office when they're there. In the clinic, I teach them a 3-minute body scan, something that they can book in their day. They can wake up in the morning and practice it for 3 minutes, and at night they can anchor their day. But I think where we fall short is the quality of life after treatment ends. And so that really lends itself to full recovery. And so employing these techniques, there's many benefits. One, just something as simple as reducing cortisol levels and not having significant stress on the body and mind for extended periods of time, something that we all would benefit from in the world today. It's an opportunity to reevaluate your life and to say, this is what really is important to me. Whereas there's a lot of people walking around that are not really conscious about how they want to live the rest of their life. They lack that awareness. So there's a lot of healthcare disparity, particularly with delivery of breast cancer care in regional areas. And so that kind of frustrated me and led me to developing a nonprofit called Restore More to provide better access so that all patients, regardless of race, regardless of geographic location, have access to the same level of modern breast cancer treatment options. One of the things that I learned is that regional patients are more likely to be only offered a mastectomy and less likely to be offered breast reconstruction. And that's really what stimulated me to develop the nonprofit Restore More to address that issue. So I think it's important that we examine our own biases and practice another pillar of mindfulness, which is non-judgment, and which is just being an impartial witness and observer without judging something as being a decision being right or wrong. That's something that I think is important as healthcare professionals that we need to identify so that we can deliver equal care to all people, regardless of geographic location. We are focused on just educating patients to make an informed decision instead of a fear-based decision so that they understand all of their breast cancer treatment options and that they can make an empowered choice. I use this example when patients are struggling with the decision. I say, if you had a tumor on your leg and I told you you can keep your leg and I could just remove the tumor, or we could remove your leg and you could have a prosthetic or not. Or by the way, you have two legs, you want to remove the other one. That's really what they're doing when they're choosing the mastectomy versus bilateral mastectomies. We don't have to remove the breast in many patients because we have such modern techniques like oncoplastic mammoplasty. We have neoadjuvant chemotherapy that we're using more and more for various tumor biologies. So I try to advocate for breast preservation in most cases, if it's appropriate. So Restore More is really about educating patients to make an informed decision and an empowered choice.